Hi, welcome to Centerville Reports Today. I'm Maureen Russell-Hodson. Everybody's familiar with public health, Dayton Montgomery County. And today we're going to talk about two services, although they offer numerous services. We're going to talk about mosquito control today and also infant mortality in a special upcoming conference. So here to tell us more, we have Dan Suffoletto and Kara Thomas. And thank you both for being here.
Thanks for having us. Great to be here today.
Yeah, and we're talking about public health. I think we hear that word, we hear about the organization typically when we're in need or there's some kind of outbreak or there's some information that we need to know about. So what is public health?
Well, public health is a collection of a lot of different programs to help improve your health, not only individually, but for the whole community at large. And we have many different programs. We have actually over 50 different programs at Public Health at 9 different locations all throughout Montgomery County. Our headquarters building is down at the Rybold building, so if you're going to the new Levitt Pavilion down there for any of those concerts, we're directly across the street, and you can even park in our garage if you like while you're going to the concert.
Well, that's a nice courtesy.
Yeah, there's a small fee though.
Oh.
Yeah, so we have our services there. We have them at 9 locations. So we provide everything from a clinic that provides vaccinations and immunizations. We provide all your restaurant inspections. We work on clean air in the community. We have our Women, Infants, and Children program to work with newborns and also moms. We have plumbing inspections. So we have really a wide variety of different types of programs.
Yeah, really responsible when you think about what our health is all about. You really can check off all those boxes in terms of programs and services that you offer.
Right.
Yeah, and I know here in Centerville, we've had a concern that we had West Nile virus that was, mosquito was tested in one of our parks. And so we had a lot of questions throughout the community about how are we going to control that, what can we do? And of course, the city of Centerville contacted public health right away.
Right.
So walk us through how mosquito testing comes about and where you test and who's testing.
Okay, right. We have a mosquito control program at Public Health. And what we do is we start out with monitoring the mosquitoes. So we have a series of traps that we set out, and we rotate them throughout Montgomery County, different locations, and then we capture the mosquitoes. We capture them, and it's called a pool of mosquitoes, so it's a group of mosquitoes, and then we take those mosquitoes and send them to the Ohio Department of Health for testing. And in this case, they're testing the mosquitoes to see if they are carrying the West Nile virus. So if they are, then they notify us that one of the mosquitoes in a certain pool has tested positive, and that's what happened at the park.
Right.
And then we will take several steps. We will notify the residents in the area through leafleting to give them information about how not only they can protect themselves, but also how they can minimize the mosquitoes in their area. And I think we'll get to that in a little bit. And then in the contracted areas, such as Centerville, we will also spray for mosquitoes as needed. So we'll take our truck out there and we will do spraying in the area to try to reduce the amount of mosquitoes. The spraying we do, though, is only going to last a certain period of time because there's always new mosquitoes that are breeding. So that's why we focus on the long term of reducing the amount of mosquitoes that are breeding. And that's why we talk about protecting your home and reducing standing water, and we'll talk about that in a bit. So
right.
It's a series of steps that need to be taken to help protect yourself, not only yourself, but your neighbors.
And we also don't want to be alarmist in that West Nile virus and it's coming to your neighborhood because it's really not like that.
Right. Well, the one main thing we want to make sure people are aware of is that West Nile virus is everywhere. We know that we're going to capture mosquitoes that are carrying West Nile. That's why we have the program to begin with in the first place. So it's not unusual to capture a mosquito that's carrying West Nile virus. It's a routine occurrence. This year, however, throughout the state of Ohio, we've been noticing there's been more mosquitoes that are...
Have an uptick in that now.
There's more mosquitoes that are carrying West Nile virus. So, of course, if there's more mosquitoes carrying West Nile virus, that increases your individual chances of contracting West Nile virus. So that's why we want to get the message out about protecting yourself. West Nile virus in and of itself, 80% of the people who may contract West Nile virus will see minimal or no effects, so they may not even know that they have West Nile virus. However, in certain people who get a severe case of West Nile virus, it can cause problems and it can actually lead to death. There's been one death in Ohio so far this year from West Nile virus, so we want people to, take protection seriously when they're outdoors.
Well, let's walk people through what precautions you should be taking, because you talked about water, and water is a mosquito's best friend, I guess.
Right. Water is where it all starts. So
Yeah.
the mosquitoes will breed in the water, and they can breed in something as small as a bottle cap. In 3 days, the mosquitoes can breed, so you want to remove as much water as you can that's standing in your home. And actually, Kara and I were talking about this coming in. She has a routine where they're emptying out their baby pool that's out. You want to make sure that is emptied regularly so you don't leave that water sitting in there.
I guess a bird bath
A
even,
bird
or-
bath, any buckets, tires, anything that's going to collect water. Certainly the gutters, you want to pay attention to those as well. So that's the first step, is removing that standing water. Then you also want to get into making sure your home is protected, making sure there's no doors left open, making sure the screens are intact if you're using screens. And then you want to use your personal protection, which is using an EPA-approved mosquito repellent. DEET is one of the best ingredients that are in the mosquito repellent. So if you look on the ingredients there and you see DEET, the higher the DEET concentration, the longer and more effective that spray will last. And one thing you can think of, summertime, people are out there. You want to just throw a can of spray in your car and just have it with you, because you never know when all of a sudden you make a last-minute decision, you're going to be outside and you need to protect yourself. You can also wear light-colored clothing and long sleeves when possible when you're outside, to reduce the amount of skin that's available for the mosquito to bite.
And then they typically are out, dusk?
Right, from dusk till dawn. There's different, for West Nile, that's the time, but there's different times for different types of mosquitoes. There's many different types of mosquitoes, so you really can come into contact with a mosquito at any time, but the Zika mosquitoes have a different kind of time frame than the West Nile mosquitoes, if you will. So anytime you're outdoors, you want to practice
take these
protection,
precautions.
take those precautions, exactly.
Let's talk about the spraying, because you had mentioned the city of Centerville contracted with public health to take care of spraying.
Right.
And then I know we had set one night, and then because of potential winds and rains,
Right.
it could not be specific, and then we had to push it back. But
Right.
but walk us through that process.
Right. I think we're going to look at a little video here, but
Okay.
you'll see in the truck. I don't know if we want to see the video now, and then I
Sure.
can talk. Let's go ahead and look at that video,
Okay.
and then we'll go ahead and talk to that.
Standing water is an attraction to mosquitoes. Eliminating those standing water areas in your yard, such as downspouts and rain gutters, baby pools, bird baths, or anything that collects water, needs to be emptied at least weekly to eliminate mosquito breeding and minimizing your exposure to mosquitoes. Another aspect of our mosquito control program is spraying for adult mosquitoes where we find positive mosquitoes for West Nile virus. This activity is limited to areas in Montgomery County that contract with public health for this service. The mosquito is killed with an ultra-low volume insecticide that is sprayed at night and is approved for use and is not a threat to human health or the environment.
Okay, so that's Tom
Okay,
Hutt
right.
from
Tom,
Public Health.
he leads our mosquito team.
He's a champion.
Yes, he does a great
answered
job.
a lot of questions for us.
I wanted to show the spray there because you can see how it's a fine mist coming out. So it's weather dependent. So if it's raining, if it's windy to a certain degree, we can't really do the spraying. So we have to wait for good weather conditions to be able to get the most effective coverage on that spray.
And you also spray in the evening. That was daytime, obviously,
Right,
for
right.
video
That was
purposes.
just for my-
but
yeah,
we
testing.
had some questions about daytime. You do it at night when it's dark?
Right, well, we're doing it at dusk when the mosquitoes are most active in this case. So, and we will notify the neighborhood. We had, in your instance, we had
Yeah.
signs up in the neighborhood to let people know what's going on. I know you guys do a good job of publicizing it, but still people may not be aware.
Right.
So we put the signs out there to let the residents know what's happening. We also have, if you see those signs out, not just in Centerville, but anywhere, there's an information number on there that you can call that gives specific information about the spraying, and we'll answer some of your questions for you. And then if you have further questions on the spraying, you leave a message, and then we'll call you back. It'll probably be Tom calling you back, but we'll call you back and answer your questions.
And so we sprayed, and then you'll do a follow-up on that spraying as well, right?
Right. We will monitor the area to see if further spraying is needed. More traps will be set out, not just in Centerville, but other areas as well. And we kind of move it around to try to get as best coverage as we can.
Okay, and really, Dan, the best place to go would be your website for more information or
Right.
call.
Right. Go to our website at phdmc.org, or you can always call us at 225-5700, and we can answer any questions that you may have about not only mosquito spraying, but any of our programs. They're all listed there on the public health
which are
website.
numerous.
Yeah, there's over 50, so it's like we could do one on every program.
One a week for a year, right?
Right.
Well, Kara, let's talk about the Infant Mortality Conference. That's coming up on September 28th, right at Sinclair.
Yes.
Define infant mortality for us.
So infant mortality is the death of a baby before their first birthday. This does not include stillbirths or abortions. It's just simply a baby who did not make it to their first birthday.
And you are offering this conference on September 28th.
Yes.
Who is invited and what can we expect?
Great question. So this conference is free and it's open to the public. There will be breakfast, lunch, and parking, again, all free of cost. We are encouraging anyone who's interested in learning more about infant mortality, some of the services that we have available, such as the role that doulas play with reducing infant mortality, the pivotal role of fatherhood and how we are supporting our fatherhood initiatives, as well as preterm birth and how that impacts infant mortality as well.
So all this will happen at the conference. You said it was free.
Yes.
You need to register though, right?
Yes, registration is on Eventbrite. So if you, when you go to Eventbrite, if you search 2018 Infant Mortality Conference and register, it will show up. And again, it's on Friday, September 28th from 8 to 4. There'll be concurrent sessions. It'll be dynamic speakers. It'll just be a great time.
And the title is How Are the Children?
Yes,
right?
so the title
As a
is
keynote speaker?
No, so the title is Caesarian and Jira. It's a phrase from the Messiah warriors in Africa. When they go to war and when they come back, they say, "How are the children?" And that's the approach that we need to take as a community. So whether you have kids or not, we're encouraging you to come and learn how our children are doing and how you can play a pivotal role in reducing infant mortality.
Wow.
And
That's a great
if I may,
conference.
it's not just for pregnant mothers
Yeah.
or
Right, yes.
families that are currently have children. It's for the whole community. There's a lot of great
It takes
information
a
in there.
village,
It's
right?
free.
It
That's
takes a
the thing,
village,
yes,
yeah.
a village. Yes.
Well, the couple things on that is, one is you never know when you're going to be pregnant, so you want to make sure you have the right information. But two, preterm births are one of the major problems with infant mortality.
Yes.
And in order to reduce preterm births, there's a lot of interventions that need to be taken well before the mother's even pregnant. So this are steps that you take in your life before you become pregnant. And there's many things, everything from access to food in your neighborhood, to having safe neighborhoods, to having a job so you can get health insurance. Of course, things like you never want to smoke, at all. So
Right.
you want to make sure that people are not smoking before they become pregnant, and certainly not when they're pregnant. But so all those different steps you can take before you become pregnant, that will greatly enhance the likelihood that you're going to have a healthy, safe, and thriving baby.
Okay, and as you said, the event is free. It is open to the public. And
Yes.
for registration information, you can either call.
Call or go to the Eventbrite website. Yes.
Okay, and that is an all-day event. Let's talk to, you mentioned a little bit before, Dan, about some of the other services, but we talked about if you need a birth record,
Right, we have our
you're the place to go.
Right, we have our vital statistics program. It's in the Ribble building, but we do want to point out that the birth and death records are available on our website, so you can order them right there online. They're mailed to you. It's the same certificates you would get if you came to the window. It only takes about 48 hours to get it, so you should get it really quickly. But if you need it that day, you're certainly welcome to come on down there to the Ribble building. Kara's in the health promotion department. We have a lot of different things. I mentioned smoking. We have a smoking cessation program. We have a diabetes prevention program. There's many different things. We have an epidemiology program that works on providing information to the community that not only people working in health can access, but also the public can access information. That's how we know things like where the infant mortality rate is the worst, so we can focus on those areas. We also work with the Community Overdose Action Team, trying to reduce the number of overdose deaths in our community. That's another community-wide collaborative that public health is involved in that you can get information on our website about.
All right, thank you very much for your time.
Thank you.
We'll see you next time.